He compared Japan and their life expectancy and their health outcomes, talking about fluoridated water and how they don't fluoridate their water. And so as a rationale for why they have better health outcomes and why their life expectancy is higher, never mind that they have mandatory fluoridation in their schools and all students have to get that at school. Those are used to kind of like get people outraged at certain topics, but we have to look at health holistically and public health holistically.
And they suggest that we want to return to a healthier time, that America is the least healthy we've been, and we want to get back to healthier times that we used to have. Now, from a data perspective, how do current public health metrics compare to those golden eras they reference?
Okay, so from like the data-driven, right, public health perspective, the reality is a lot more nuanced. While certain health issues have increased, overall public health metrics, like they have significantly improved, right, over the decades. And then when we take a look at life expectancy, again, we see the same patterns. We see us going, from roughly 47, right, years of age is the average life expectancy back in the 1900s till today. And as you can imagine, as people age, they get, chronic illness. Now, and we can take a look at that, and we can also acknowledge at the same time that the improvements have not been uniform across all populations.
What I see is across the board, there is disparity in the population that I'm seeing. And it is truth that in lower income communities, especially Latino and African American neighborhoods, they have 2 to 35 times more advertising space on billboards devoted to food and beverages compared to other neighborhoods. That is not by design. That is an unfortunate reality of policy.
Living a well life and wellness is something that we're all, and medical doctors talk all the time about, you guys get a bad rap for like never speaking about nutrition or physical activity, but the medical doctors I've spoken with, they constantly bring that up. There's a difference between that and selling you a $130 colostrum supplement because it's going to be some sort of cure-all. I just think we need to really make sure that we're focusing in on the predatory wellness when we're talking about wellness, and I don't want people to think we don't want people to live healthy lifestyles.
Welcome back to the show. It is me, Dr. Mona. I am so excited to have the guests I do today. We have a 3-person conversation, and today I want to have a real, honest talk about the Make America Healthy Again movement. On the surface, the idea of making America healthier sounds like something we should all get behind. Me and both of my guests do. But what does this movement actually stand for? What does it get right? What does it get completely wrong? And most importantly, what are the implications for public health? Something that my guests and I both feel very strongly about. And as a pediatrician, I always think about how these messages impact children and families, but I also wanted to tackle this from all angles. So I brought in 2 amazing experts that you may know, Dr. Jessica Knurick, a PhD in nutrition science and registered dietitian, and Nini Munoz, a data scientist specializing in health statistics. And today we are like 3 powers combined, like Captain Planet, talking about breaking down the facts, the fiction, and the bigger picture behind the Make America Healthy Again movement. Thank you both of you for joining me today.
Good morning, California time. Hi, Mona.
Yes.
Hi, Jess.
Hi, thanks for having me.
I'm really appreciative that we could do this, because when I thought about this episode, I was going to do it solo, but I was like, you know what? I am not the expert at everything. And that's something that we want to get across here, right? That all of us that make these decisions in public health and health have our niches, have our expertise. And the goal of this conversation is to bring strengths from 3 different areas and have this very supportive and pro-science and, understanding the limitations of science, and also just understanding the progress we've made so we can really understand, and the listeners can understand, why we have concerns about the Make America Healthy Again movement. So really glad that you all are here today. And I'm going to ask Nini the first question. The Make America Healthy movement, I think it's MAHA. Am I pronouncing it right? Or MAHA? What is
MAHA.
it? I'm just going to call it MAHA.
I say
okay.
MAHA.
MAHA. Okay, so I'm going to call it MAHA. So the MAHA movement, a lot of it is endorsed by many famous figures like Robert Kennedy Jr., who's now the Secretary, the Health and Human Services Secretary. And they suggest that we want to return to a healthier time, that America is the least healthy we've been, and we want to get back to healthier times that we used to have. Now, from a data perspective, how do current public health metrics compare to those golden eras they reference?
Okay, so from like the data-driven, right, public health perspective, the reality is a lot more nuanced, right? So while certain health issues have increased, and I'll let Jess talk more about those, like overall public health metrics, like they have significantly improved, right, over the decades. And rather than thinking that the US has had like an outright decline in health, what we really have seen for the most part is like other industrialized nations, Western nations, has been a shift in the burden of disease, right? And I think it's fair to then discuss how did that come about, right? From like the public health implementation of policies like sanitation and, chlorinating water, and of course vaccines and modern medicine, right? So back then, the leading causes of death were infectious disease, right? We could take a look at the 1900s and we see that about 600 deaths per 100,000 relative to the last data that I have is from 2023, which was, I think, about 10.9 for pneumonia and influenza per 100,000. It didn't even make the top 10 leading causes of death. So we really have seen a huge shift in deaths from infectious disease. And to that end, we also see huge changes in infant mortality. We see that in the 1900s, 1 in 6 infants would die before their first birthday, with that number coming down to around 30 in the 1950s and 60s, and now down to 5.4, which is still greater than other OECD countries, but we're still talking about, a huge, decline in the number of infant deaths every year. And then when we take a look at life expectancy, again, we see the same patterns. We see us going, from roughly 47, right, years of age is the average life expectancy back in the 1900s till today, right, roughly 77. And we did get that hit from the pandemic. We saw that decline. And I think we could take a look at that, right? And we can also take a look at how many people were 65 and over back in the 1900s, about 4%, right? That number is fourfold higher today. And as you can imagine, as people age, they get, chronic illness. Now, and we can take a look at that. And we can also acknowledge at the same time that the improvements have not been uniform across all populations. We very much have like disparities built into those numbers, right? And, we can talk a little bit more about what those are, later, but it is not uniform. And so, of course, as the burden of disease has shifted, right, we're no longer dying before puberty. We, thank goodness.
Or 47, which is like 8 years from me. So
Exactly.
I'm happy about that news.
Exactly. So of course now we're going to get back pain, right?
Yeah.
Like I
Yeah.
remember getting my first bit of
Yes.
back pain in my 30s. I was going to the gym, doing like one of those like dumbbell tricks, and I was like, oh my God, and I had back pain for like 6 months. So of course now we see a shift, right? And we see more chronic disease. And we have seen an increase, right, in the prevalence of like obesity, right, defined as the BMI above 30, right, from like the 1960s to about from 13% to more recently, which is 43%. Same can be said for diabetes, going from, the 1960s to a little bit under 1% to now roughly 11.3%. And we see the same, with, cancers and heart disease, even though if you take a look at the data a little bit more granularly, especially for heart disease and cancer, you do see a decline. So we have made progress in those. And the one last thing I want to add is that when we see increases in prevalence, we also have to acknowledge how the diagnostic criteria have changed, right? Because a lot of people view an increase in prevalence as like, oh my goodness, things are getting worse. When a lot of that is like the recommendations for screenings have changed, or the fact, like when we introduced like the EKG, of course, we're going to pick up a lot more heart disease.
Yeah.
And that was a huge part of that trend where you saw heart disease peak in 1968 or 1969, right? We had like 379 per 100,000, deaths. And now that number is down to like 160 roughly. So I think all of those things have to be considered. And it's a very nuanced picture when we talk about, health outcomes, right?
And I think, your point is valid about the detecting of diseases earlier, right? EKGs, mammograms, colon cancer screening, all of that is a result of science
Yeah.
and obviously public health initiatives,
Yeah.
vaccination, all of that. And I think my biggest concern with the narrative around the movement and around the what is being said is that it's like a conspiracy, right? That, oh, why are we having more autism, right? Using that as a prime example. I know, we're
Mhm.
talking about that as a developmental thing, but it is true from what I see from now 13 years being in training and practicing that we have gotten really good at screening. Like, we have not screened a lot of children. Like, I think back 12 years ago when I was in residency, and I think about the kids and I'm like, that kid probably had autism and we didn't have the good screening tools. We
Yeah.
didn't know. And now that kid is probably 7 and never got the diagnoses that he could have had. And so that is not a bad thing. This is all good stuff. And I love what you said about, they're romanticizing a past where fewer people live long enough to even get the chronic diseases,
Pretty
right?
much.
Like the
Yeah.
back pain, the, maybe cancer risks later at 60, 70. Yeah, if they were dying at 47, we didn't know what they were getting. So I love that point because that really drives home that we are living longer. There's no doubt about that. We don't have, I think they've thrown out numbers that we have lower life expectancy rates than other countries. And that may be true of like the Japanese culture. I know, I watched this documentary how Japanese live longer, but they also have other things in their public health.
Yeah.
They have a lot of outdoor activity availability. Their food is different. Like, there's a whole multifactorial reason for health, which I know we all agree. And I know Jess can get into this more with the whole nutrition aspect, is that we are lacking that whole conversation here. And I love when Jess, we can even segue to you, like what we're missing in that conversation in America. They talk so much about, let's get rid of these things or seed oils or artificial dyes. But what are we missing in the nutrition aspect of what we can do to actually make America healthy again that is not being done maybe by the current administration or by the MAHA movement?
Yeah, I mean, there's just so many things, right? I
Yeah.
saw there was a post that Callie Means, who's one of the people in MAHA
Yes.
movement, he compared Japan and their life expectancy and their health outcomes, talking about fluoridated water and how they don't fluoridate their water, and so as a rationale for why they have better health outcomes and why their life expectancy is higher. Never mind that they have mandatory fluoridation in their schools, and all students have to get that at school, and never mind that they have universal health care, and never mind that they have, their nutrition looks a lot different than our nutrition, and their food environment is not set up for corporations to make profits. And so it's not 70% ultra processed foods like ours is.
Yes.
There's just so many things and aspects that go into health. And so I like to try to help people to understand that, like, those are used to kind of like get people outraged at certain topics, but we have to look at health holistically and public health holistically. And I love what Nini was talking about in terms of talking about chronic disease. I do think that it's obviously a very nuanced issue, and you have to bring in obviously we're living longer. Obviously we have less infectious disease. And so by nature of that, just alone, no matter if nothing changed in our environment, we would have more chronic disease, because chronic disease is a function of living longer, right? And
Yeah.
so you have to die from something, right? And
Yeah.
so,
Right. Right.
That's what we say. That's what my husband tells me. I was like, honey, you're
yeah.
gonna die of something.
Yes.
I mean, it's not doesn't sound glamorous, but it's
We would like to
true.
prolong it, but yes,
Yeah.
exactly right. Yeah.
Well, and that's my next point. So, but
Yeah.
but having said that, there are still a lot of lifestyle factors that
Yeah.
can be addressed in our country that can help to either prevent or at least delay chronic disease and the chronic disease that we see right now. Because what we're seeing is a lot of people living with chronic disease for a long time, and longer than they maybe need to be living with chronic disease. If we were able to kind of work on some of these environmental factors, like our food environment, like our built environment, which is like our roads and cities, and we can talk about all of those different aspects of policy that could
Yeah.
actually improve chronic disease versus maybe just focusing on single ingredients, which is a lot of the focus right now.
And so I think one of the narratives that I'm hearing, and I know you all got this too, if you have been speaking out against these issues or against, some of these high profile people spreading this misinformation or this fear mongering, is Dr. Mona, Jess, Nini, why wouldn't we want this stuff? Why do you not want red dyes out of food? Why don't you want seed oil out of food? What would be your answer? And maybe I'll ask Jess first because I'm talking about more food related responses. What would be your answer? How have you approached those conversations?
Yeah, so it's not that I don't want red dye out of food.
Yes.
It's that I want honest conversations about our food additives. And so if
Yeah.
we want to take an approach of having a more precautionary approach to our food additives like they do in Europe, even though the EU has deemed many of these food additives safe, they still allow all of the food dyes that
Yeah.
we talk about often. I don't think people realize that. They think they're banned in Europe, and they're not. They're allowed in Europe. They're just not used as frequently in their food supply. But if we want to take a more precautionary approach, let's talk about doing that. And let's talk about at the FDA level doing that. Because right now, we take a little bit of a different approach and we look at risk, which I would argue is a more evidence based way to actually approach food additives. But I'm not opposed to taking a precautionary approach, right? Which is basically risk is the best way to explain it is, in the way that I always explained it in my research methods class is there's a shark in the water, right? That's a hazard if there's a
Yeah.
shark in the water. And so they in Europe, they often take a hazard-based approach. So if there's a shark in the water, they're a little bit more precautionary. What a risk is it introduces a person next to the shark. So there's a person swimming next to the shark in the water, and that introduces risk, right? So that person is now at risk. And so that's what we consider when we look at these food additives. So is at the amounts that we're exposed to, is this particular ingredient harmful? Has it ever
Yeah.
shown harm in humans? And if the answer is no, we generally allow those additives. But again, if we want to change that to being more precautionary, let's have an honest conversation about it instead of just lying and saying these food additives are banned in Europe, America is poisoning us, which is just not true, right? And so that's what I would say first, is let's have an honest conversation about it. And second, I always like to bring it back to how it's a major distraction from things that can actually help improve public health. So if I were to make a list just randomly of
Yeah.
1 to 10 things that could help improve chronic disease in this country and improve our food environments in this country, banning, artificial dyes is going to be at the very bottom of that list, right? And so if we put all of our effort into something that's going to make very little impact on public health, because let's think about what these dyes are in, right? I'm using dyes. There's a couple of other like
Yeah.
preservatives that they talk about, but they're in ultra processed, generally high sugar, nutrient devoid foods that we would like to see people consuming less of, right? If you swap out, red dye 40 in Skittles and you add in Carmine or beet juice, it's still Skittles. It's still a high
Yeah.
sugar, nutrient devoid food that we should be consuming less of. And so if we put all of our focus into those ingredient swaps and we're not focused on 1 through 9 or 1 through 9 and 0.999, then we're missing the forest for the trees. Right. And that can be really problematic because there's only so much political will in Washington to make changes for
Yeah.
public health. And
I
so
mean,
so I like to bring people back to that.
it was already so poorly funded, and we think about, public health initiatives, initiatives for lower income families. All of these things were already kind of scraping by. We saw this in the pandemic too, and then now you have administration and voices from the top saying, let's question things that really don't need to be questioned. I mean, my contribution to here is obviously about vaccines whenever I talk about anything, because that's my area of expertise when it comes to obviously giving them to children and what I know about them. But Nini, is there anything else you wanted to add to that follow up from what Jess was saying?
Yeah, to Jess's point, they set up these false dichotomies, right?
Yeah.
So that's like the whole, like the whole trend of the movement, right? You see this or that, right? So and one of the things that they do, as Jess mentioned, is they take the risk out of context, right?
Yeah.
Because if you like, I could tell people today, oh yeah, there have been 22 times more airplane crashes this year relative to like last year, right? And then, well, what does that mean, right? If you take a look at what we say like our historical process control charts, you will see that that's not outside of what we call statistical noise, right?
Mhm.
Or it takes things out of context, that most of those airplane crashes, and you're probably seeing it a lot in the news, right, are from private aircraft and they're not in commercial aircraft as expected. So by really taking the risk out of context, that's how these narratives get over amplified, setting up these false dichotomies of this or that, when in reality, it's a lot more complex, right? And to Jess's point, like, yeah, if you swap one ingredient for the other, now you've introduced new risk. And we always say in data science and engineering, you don't get rid of risk, you just replace it with another one,
Yeah.
right? It's just, and so like, and that's what often gets lost in these discussions.
And I, in my offices, obviously on social, parents have a lot of questions about dyes and all of these things, which I think is really an important thing is that we want to have conversations around science. We want to have curiosity, right? Like, I think
Mhm.
some of the sentiment is, well, why don't you want to ask these questions? But using the vaccine example, and then I want to go into something about the food, this whole at this point at the timing of this recording, they are now, the CDC is saying that they want to research the connection between vaccines and autism, which has been debunked multiple times. And so the reason we get frustrated is not because we think they're going to expose something, because we know it's not there. It's because it has been done in the United States, in other countries, in a controlled, proper way multiple times. So now if we keep doing these studies, what it's saying to people in America is, actually, yeah, we do think that there is an issue. Even though we said there's not an issue, we just want to do more research on an area that's already been debunked. So now it's stirring up, well, is it? Is it? Because now our
Yeah.
government is testing it. And then that isn't fair to the research that's been done. It's expensive. These things are not cheap to run a properly done study, right? You need a proper study. And so my concern with that is, are we now going to create studies that aren't reputable? Is it just to feed a narrative, right? There was a study that came out of the Medicaid population in Florida, which was done by a prominent anti-vaxxer and was peer reviewed by a prominent anti-vaxxer. That is not adequate research studies.
And
And
was
I know,
published on a WordPress blog.
In a
yes,
WordPress blog.
and I know we've all spoken about it. And I was like, oh my, I was on a vacation when I saw it. I'm like, everyone was like, why are you so upset? I'm like, guys, I just need a moment to read this. But it was obvious to us, I've done research too in my undergrad. So I know that these things are not, they're supposed to be done a certain way. And that is what is concerning. It's not the questioning of science. It's that, are we questioning it the wrong way? And are we feeding time and energy into things that were refuted? And one of the big things about the dye, I have a lot of families wanting the best in the foods for their children. And I think that, Jess, your point about it's not even just about removing the dye, it's about the actual food. And I work in a very diverse population. I take care of billionaires' children, but I also take care of Medicaid children. And I say that because of this. What I see is across the board, there is disparity in the population that I'm seeing. And it is truth that in lower income communities, especially Latino and African American neighborhoods, they have 2 to 35 times more advertising space on billboards devoted to food and
Mhm.
beverages compared to other neighborhoods. And I see this when I drive around my city. I live in Fort Lauderdale, and I drive around and I go into an area that is more underserved, and you just all of a sudden see billboards for STIs and billboards for fast food and soda. And that is part of the problem, right? I think this is just one of the things that I know, Jess, you said you have a long list, but one of the things is, how are we advertising to these families? What sort of nutrition education are these families getting? Because when I see them, it sounds like I'm the first one having to tell them, because there's a generational, well, my mom did this and this is the money we have. How do I make this money go further? And what is afforded by there's, whatever they have to pay for these foods is local stores that carry these items, right? They don't have fresh grocery stores. They have corner stores at the front. It's chips and it's processed foods. It's ultra processed food. So how are we going to do the education? What are these lower income families dealing with that is not able to get them out of the poverty to be able to have the education to make smarter food choices that in turn can reduce the risk of childhood obesity, of, cholesterol? That is what I get frustrated, but the conversations on MAHA are not having, because they're not thinking of the poor Americans. They're not. I mean, there is no policy being made thinking about lower income families that I have to now have these discussions with when they're left in the dust, when Medicaid cuts are happening because they want to make cuts for whoever they want to make cuts for. And it's just a frustrating cycle of the sicker are just going to get sicker, in my opinion. And that's what I'm seeing right now. And I've been seeing it, and I just worry it's going to get worse.
Yeah, I mean, absolutely. This the one of my biggest frustrations with the MAHA movement is it's very targeted toward middle to upper class individuals.
Mhm,
Yeah.
mhm.
And like I made a video, I think, one time that was like, when you already have access to healthcare and access to education and access to food, and fruits and vegetables and fresh food, then you have the luxury of worrying about, like number 10
Seed
out of
oil.
10 on the list, which is like food additives, right? Like,
Yeah.
oh, so like red dye 40 in the Skittles my kid's going to have a birthday party every couple of weeks, right? So, or every couple of months. And so, and it's like not even thinking about the vast majority of the population who are not thinking about these like food additives. They're thinking about can I have access? Can I afford some fruits and vegetables, right? Because of the
Yeah.
way that our subsidies are. And we tend to make produce more expensive in this country. And we could fix that from a policy perspective, but we don't. And we're not focused on those changes because we're focused on these additive changes. And so that's very frustrating, is that like it's one of my biggest frustrations is it's a major distraction from so many policy changes that could affect the people who are most impacted by chronic disease. We keep talking about wanting to improve chronic disease. If you want to improve chronic disease from a public health perspective, you have to target the groups that are disproportionately negatively impacted by chronic disease, and that's low income populations. And there's research to show, I mean, you can look at the maps too. You can look at poverty
Yeah.
maps in America, and then you can look at any chronic disease you want to put up there, and you'll see that it follows right along the stroke belt, right along the poverty belt. They're all
Yep.
the same belt. And so when you look at those, and then you look at the research that shows that between the highest and lowest income populations, there's a 15-year life expectancy gap for men and a 10-year life expectancy gap for women. So when you see that, you're like, okay, well, what can we do to actually target these populations? And now, with this movement, they are aligned with a party that is trying to take healthcare and
Yeah.
food assistance from this same population, which are evidence-based ways, by the way. From a public health perspective, they're evidence-based ways to improve the health of Americans, is to give them nutrition assistance, is to get people access to healthcare. And so it flies in the face of making America healthy when you're kind of doing that and then talking about food additives as if they care about food additives when they can't get access to healthcare and food.
And you're right that it's what concerns me is that when, I'm in Florida, which is quote unquote a red state, a lot of the red states, like you said, and this is not making it political, but it's just fact that a lot of our southern red states also have the highest obesity levels and the lowest education rates. And
Absolutely.
so that is not by design. That is
Mhm.
an unfortunate reality of policy, right? I mean, we
Yeah.
see this in state level. And so that's why I get concerned is that, Louisiana recently had the, removal of the mass vaccination education programs. You mean they're still allowing vaccines, but they're not doing mass, clinics and promotion, billboards, all the things that I know really matter when I look at these lower income families that I work with in Florida. And so that is a concerning thing to me because now if the government is having all this messaging, or they say, let's throw it to the states. The states, you all can decide what you do with your education program, or you can decide what you do. You know who's going to get most disadvantaged? Red states.
Yeah.
Oh,
Because,
absolutely.
and that is scary to me that I am living
Yep.
in a red state with my children who their peers, because
Mhm.
they do not have access or they do not have money, are not going to get the same basic outcome of health and education, which I believe every child should have access to. Like health and education should not be based on how much money you make in America,
Yeah.
is my opinion.
Or
Right.
which state you live in, right? Yeah.
Basic health and education, right? But it is.
Yeah.
It's
Yeah.
becoming that, and it's scary to me because it's going to become more like a developing country
Yeah.
than it is a developed one.
It's kind of funny you mentioned that because I come from Colombia, right? And I
Mhm.
have to explain to people why I left. I left Colombia because you're trapped in cycles of classism, right? And there's the racial component, right? So all schooling there is for the most part privatized. So
Yeah.
there are public schools, but they are really for the marginally poor. What this means is that when you take a look at your distribution, right, a huge part of your population is not getting access to opportunities. And it's kind of funny
Yeah.
that when you take a look at who the best doctors are in Colombia, they're not the smarter ones. They're the ones that could have had the most potential. They're the ones whose parents had a practice.
Yeah.
And that's why immigrants leave their countries. And it's interesting you really bring this up because I've been talking to my husband about this for years. I'm like, why are they trying to make this like Colombia? And then you
Yeah.
end up having so much poverty. So it so I think that there's this misconception that they can just get rid of poverty, right? Like it's just,
Yeah.
we're just going to like do it away. We're going to force it doesn't go away. People just don't die. Right? People continue to live with more and more comorbidities, and it impacts educational attainment. Of course, that's immediately related to like the economy, right? So,
Yeah.
but what ends up happening, at least what's happened in Colombia, and I'm not sure what would happen here, is that the middle class in Colombia um, has to pay so much more tax
Mhm.
to sustain that, right? Because as I said, it's not as if though these individuals just perish, right? You can't just do away with poverty, especially when you're making it worse. And
Yeah.
so, and that's what really destabilizes democracies. I mean, I escaped that. We were like caught in the middle of a civil war. People think that civil war is people in a battlefield, and I'm always like, no, it's more like isolated terrorism,
Yeah,
right?
now it's on social media. Yeah, now
Yeah,
it's digital civil wars.
yeah, but it's really fascinating to
Yeah.
watch. For me, like that, I lived that.
Yeah.
I had to escape that because there was no opportunity for me to do what I could do here, right? There's no path for meritocracy in these developing nations, right? It's just these classist systems that get perpetuated by whatever infrastructure there is or lack of, and it just worsens disparity. It
Yeah.
worsens disparity, and that's what a lot of individuals point to. It's like, people always say like, oh, let's take a look at our GDP, and I'm like, no, 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 let's look at our disparity. That's the more telling figure, because as you mentioned, it is directly tied to health outcomes. Like,
Yeah.
we know this, we see this, like there is just an abundance of data that shows you that individuals that make less than, households that make less than $25,000 are almost 4 times as likely to have multiple chronic diseases, right? And so on and so forth. We know that, as Jess mentioned, there's a huge gap in the life expectancy, right? I think in Chicago alone, it was about 11 years in life expectancy between the wealthiest and the poorest
Yeah.
populations, right? We know that 40% of adults that don't have, that don't have a high school diploma, right? They're uninsured. So already you see that connection between, poverty, educational attainment, and health outcome. And it's just really going to trap people in those cycles, and it's going to make it so much worse.
Absolutely. And Jess, I want you to remember the list of things because I do want to talk about that at
Yeah.
the end. Okay. I remember you also did you also did put it on your stories too. And I like screenshot it because I wanted you, to bring it up on the conversation today because it's stuff that I also agree with. We've already spoken to a lot of it, but I would love to end the conversation today with that. So don't forget that. And I do want to talk about vaccines. We did speak about it already in some detail. But obviously Robert Kennedy Jr. is now at the head of the Health and Human Services, and he's known for his vaccine skepticism, even though people keep telling me he's not anti-vaccine. I'm like, how many videos do you need me to show you that he has said Gardasil is the most worst vaccine? Gardasil is the HPV vaccine for anyone who's not familiar, which has been shown to actually reduce the incidence of cervical cancer. Him telling us that, we don't, I would never recommend someone to get a vaccine. Whenever I run into someone when I'm hiking, I tell them that I'm not going to they shouldn't get a vaccine for their baby. That is vaccine skepticism. That
Yeah.
is anti-vaccine sentiment. And that doesn't mean we should be able to call that out. Like that is fact. So how might his appointment influence public trust in health policies and vaccination programs? And more importantly, Nini, what is his viewpoint and the MAHA movement getting wrong about anything related to vaccine data that you can provide? And maybe
Well,
give us the you can do the measles version since we're dealing with a measles outbreak, whatever you
yeah.
feel is appropriate that people should hear.
So, and as you mentioned earlier, he is casting doubt, right, on the safety and effectiveness of vaccines, which I would consider like single-handedly the most studied intervention that we
Yeah.
have, right? If you take a look at the in-person years, we have so much data on their safety and their effectiveness. And he is going to, try to change that narrative, right? Like I'm already getting ready for whatever study is going to be coming out so that we're going to have to tackle that because
Yeah.
it is going to create not just confusion, but it's also going to erode, right, whatever trust we have left, right, in public health and public health institutions. And so, and I think one of the things to really consider, again, going back to that false dichotomy where he puts chronic disease versus infectious disease, when in reality, as you just mentioned, they're directly correlated. Like there is a reason that multiple sclerosis is being tackled by taking a look at Epstein-Barr, right? They take a look at the latest work that's being done to get cures for multiple sclerosis. They're looking
Yeah.
at EBV. There's a reason why the incidence of cervical cancer plummeted to zero, right? When, in the latest, HPV vaccine data, right? Because they're directly correlated. You just cannot undo one, right? And try to address the other. And there's so much more that we don't know, right? We know that, H. pylori, right, it's related to like, stomach cancers. And so and the
Yeah.
list goes on and on, right? So it definitely, again, not only erodes the public trust, on the public health front in our vaccines, but it also creates a lot of confusion, right? And really just creates this or that, right, scenario that really doesn't exist. And you probably know this more as a pediatrician, that there's a reason we have like the vaccine schedule, right?
Yeah.
I remember when I took my daughter to the pediatrician, and she was so grateful that I was like, yeah, do all shots at once. And she was like,
A
really? And I'm
pediatrician?
like,
Yeah. It's now surprising. Yeah. I mean, or I'm
because
not dealing with a conversation. And I don't mind having the conversations, but they take a lot longer. And, it ends up being like, what's going to happen at the end of this? Is it going to be like, you can understand
yeah,
why it's important or not. So we do get a little happy when
yeah,
like,
she was
oh, thank
ecstatic. She
you.
was like, she
Thank
was like,
you.
really?
Yeah.
I can do all four?
Yeah.
I was like, yeah, because there's a reason the vaccine schedule exists, right? We know that there are specific interactions, like a vaccine might not be as effective, right? If you combine it with another one. We also have to take a look at the data. When are children more likely to see these diseases, right? So there's a
Yes.
reason for that. Like
Right.
talking about like the measles vaccine, right? It's administered at 12 months, right, of age, because it could interfere with placental antibodies from pregnancy, right? So we don't administer it earlier, or it doesn't really count, because we know that the immune response can be dampened. And so, that is like one concern, that we really see happening, because there's already always conversations about like the delayed vaccine schedule, and there's no real data on that. All
Yeah.
the data that we have, even when you take a look at controlled trials on new vaccines, right, that control group is, the prior vaccine cohort, right? And you are comparing against that baseline data, right? So it really can be very problematic, even for like our own vaccine effectiveness, right? Like many of these vaccines, especially when you are, taking a look at the live attenuated virus vaccines, there's a certain time they have to be administered. They can't be combined with other things. And so
Right.
I think that is one big concern on that vaccine front.
Yeah, and I think I have had conversations with so many of my families. Most of them end up getting vaccines. Some of them do a augmented schedule, knowing that I do like the routine schedule, and a lot of it is because my feeling is I rather have them get it than not get it at all. So if they're like, you know what, I want to do one at a time, and I will come back every week to get it done one at a time. I tell them it's better to do it together because that's less injections, less additives, product, whatever, but they still want to do one at a time. And I support that. But one of the common things that I get asked is, well, then why are there pediatricians out there that promote these alternative schedules? Because they're pediatricians. What do they know that you don't know? And I want to be very clear about this, that anytime you have someone who is also a credentialed expert that is now going against the grain, you got to ask yourself a few things. What are they exactly saying? Because I sometimes we can have different nuance in how we do recommendations. Like I may say, your kid is healthy, the risk of getting COVID and having complications is much lower. You can decide, or, flu, I would still love you to consider the flu vaccine. Maybe you make personal choices with your doctor, but an outright, I think a delayed schedule is recommended. There is more money in being an anti-vax pediatrician or a pediatrician that will say, let's space out the schedule, than there is in actually being a pediatrician.
Yeah.
I can make a lot more money going out there and saying, you know what, everybody? Let's do an alternative schedule because we don't need this anymore. You don't need to do that. If I'm giving that advice to everybody, because it is such a personalized decision. So you got to be careful when you're hearing specialized people talk about vaccines and saying, well, no. And Dr. Sears is a very popular one, right? He popularized the alternative schedule. And a lot of my patients come in wanting to follow Dr. Sears' schedule, and I say, I need you to understand that Dr. Sears' schedule is not based on any data. So if we do his schedule, this is on your choice, understanding that we don't know the efficacy. And if you want to continue, that is your choice. I'm fine. But then I have to explain to them why the schedule, the CDC schedule, what you just said beautifully, Nini, that I want them to be covered for these things when they most need it, right? DTaP. I don't want to wait for DTaP because it's the babies I'm most worried about for pertussis. For rotavirus, if your child is in daycare, I really need them to consider getting the rotavirus. And then measles, you brought up beautifully. And so sometimes people just don't know that. And a huge struggle that we're dealing with is that pediatricians are losing time with their patients with corporate reimbursements, and like the less time we get with patients means the less time to have these conversations. And I've spoken about this a lot, that then people start going online. People start
Mhm.
going to places where they can't get that conversation going, and I think that's a huge disservice to patients when we can't have these. Hey, I hear what you're saying, but let me explain it to you. And that's why I love talking to both of you who do this online, right? Let me explain to you. And for you, Jess, how does this apply to your specialty, right? Obviously, I know you punt vaccine education to other people because that's not your area of expertise, and I appreciate that. But in terms of the nutrition, how has this sort of nutrition skepticism, how has this sort of played out in your area of expertise?
Well, I think what's interesting about what you said in terms of how there is a lot of money to be made in kind of going against the grain on social media, it's the oddest thing too, because people look at those, credentialed people who are spreading kind of what we would term like misinformation, right? I mean, it's not backed by evidence. And they look at them as like these brave kind of like
Yes.
whistleblowers who are like in it for the good of their heart. And like we are the ones who are like paid off. And it's just wild, particularly in my field. I don't know about yours, but in the nutrition space, oh my god, I could make so much more money if I used my
Yes.
credentials and said that everything that the actual experts were saying was wrong and sold a whole like website full of wellness solutions and $5,000 hyperbaric chambers and detoxes and like I it's just mind-blowing to me that like people like that are considered these like really important doing important work and being so brave. Brave is like a term I hear all the time, and it's like, no, it's not bravery. They're making millions of dollars.
From
Like
Yeah.
they
lying to you. And they're
millions
lying.
of dollars just
Yeah.
lying, and it's so easy to do. You just get on, you do some sort of like conspiratorial fear-mongering post that social media algorithms love, right? And
Yeah.
they'll show it to lots of people. It's so much harder to go on and actually talk about the actual evidence and talk about it in a nuanced way and get views that way. And then, by the way, not sell anything for it.
Well, I
I
and
know.
It's just wild.
I think Jess, you had talked about like the formula, right? Like it's like they create fear around something, they hold your hand a little bit, and then they sell you something, right? What was the formula that you talked about, like how to call out misinformation?
Yeah, yeah, that's basically it, right? They
Right.
they they scare the shit out of you, and
Yes.
then
Yes.
and then they sell you a solution to a problem they made up.
They made up.
Yeah, I mean, we see this with a lot of and my biggest struggle in the pediatric space is with, naturopaths, right? Because I do believe naturopaths have a role in this world, and I believe chiropractors have a role in this world. I do believe all of us with our expertise can, but when it starts to be that, when it starts to say, "Let me create fear," and I've seen this, right? The fear is there. "Oh my gosh, this is gonna harm your kid," but I get it. I'm a mama too, and as a mama, like, you just want the best, but, comment book for my ebook
Comment.
on this, and I will send it to you for 89.99, and we will get through this together. And I'm like, can we not see through the BS here? And you're right, Jess. I could make far more money doing that and selling all the supplements in the world, or even branding myself with supplement companies that come out of the woodworks wanting me to partner with them, saying, "Hey, this
Yeah,
is the end all be all for immune health." And I'm like, but it's not. Like,
yeah.
how can I lie to my followers? Because I know, could it be something that we can add to a diet? Sure. Could, doing all these things like we talk about, but it's not a definitive thing. And we talked about this already. It's this black and white definitive dichotomy, this sort of this is what's good and this is what's bad, that I think is ruining a lot of the healthcare education. And a lot of it is happening online. And it's so stressful. It's so frustrating because you're like, I can see through it, but a lot of consumers cannot. And we are all dealing with that in our offices, online, like having to explain this stuff and say, I get it, but no, let me explain why. And I don't want you to feel like you are a terrible mom or dad if you didn't buy that supplement, or if you couldn't afford to join the $100 a month membership to get elevated health education.
Yeah.
Like, it's an unfortunate reality, and it's business. Everything's a business. And
It's a business model.
yeah,
I
it's
was
sad.
totally naive about that, by the way, when I
Yeah.
first started doing this. And then, I took some time off from social media after I had my daughter because, postpartum. And then I came back and then I was like looking into it and I was like, wait, they were making millions during like the COVID pandemic. I was just totally like out of the loop by how many of these individuals had their own like supplement brand, like
Yeah.
McCullough, for instance. McCullough, like he has popularized the idea of like COVID vaccines are not, carry all this risk, and there's vaccine induced myocarditis, which we know is a real risk because there's always
Yes.
a kernel of truth, right? But then he also is like the chief scientific officer or something like that of a wellness company. And like if you go to the wellness, like the website, one of the products they sell is like the anti-spike like capsule,
Yeah.
right? This whole idea about around vaccine shedding, and there is so much money to be made, especially because they're creating spaces where I think what you're referring to is the fallacy called Galileoism, like Galileo, right? How Galileo was first persecuted for his beliefs, right? And so they're creating these spaces where if you cannot find any other information that confirms your beliefs,
Right.
well, here is this space. And by becoming that niche space, they can more readily monetize what they do than we could, because we're just disseminating information that's publicly available, right? And
Right.
just, we're content aggregators to that extent, right? We're just putting together information that's already out there. But it really is a huge business model.
Yeah.
Huge. Yeah.
And
And
I
I
think
have,
even
yeah.
more than the money part, I think it's also it has become this like world that, as Nini kind of said, it really confirms biases. And so when that happens, I have done posts where I take somebody else's post. Let's say it's like Dr. Mark Hyman, who I do a lot, and
Yeah.
and it's just blatantly false, and it's so easily provable that it's false, and I like prove it in the video, and I'll show like how it's false, and I will still get so much pushback because people just they already believe kind of the idea that the science is corrupt and wellness is not, and wellness is like and the information, people need to be healthier, and so it doesn't matter if these people are lying to you in their posts, because the end result they believe in. And I think that's just a really dangerous place to kind of find ourselves in. And Mona, you said something really important though that I do think we need to talk about, which is like, why has this space been able to do what they're
Yeah.
doing? And I call it predatory wellness because I am actually very pro wellness, right?
Yes.
I
As
have a
am I.
PhD in nutrition science. Like I really have always been like in the prevention. My dissertation work was in the prevention of chronic disease. I live really what I call like wellness focused life, right? Like I'm exercising daily. I'm eating whole foods. I'm trying to like meditate as much as I can. I don't much, but
Yeah.
I'm trying to get
Yeah.
outside, all the things that are true wellness, but that's not predatory wellness, right? And so when we're talking about wellness, that I just want to make clear, that's kind of what we're talking about. This like, let's scare you out of these things, pretend science is a quote unquote cult, and then sell you all of these products to make millions of dollars, which is happening in that space. But again, like, why is that space allowed and able to become so big? And I do think that it's because we do have these problems in our medical system. And
Hmm.
a lot of people are feeling like, okay, well, I'm not getting what I need from like the medical system. And so I'm going to go online for my information. And then they start, getting into an algorithm. And that's where they start getting all of their information. And so I do think we need to figure out a way. And science also has a problem because we're not great communicators in the scientific community. And we
Yes.
also kind of keep everything like we write in a way that's not accessible for people. Our work is behind paywalls that you have to pay like $75 to read a single article, right? So that's a big problem as well. And you don't have a lot of people like Bill Nye out there, like being like accessible science communicators. So I think we have problems in the space that we have to deal with in order to make like actual evidence-based information more accessible for
Correct.
people so that they're not driven to this wellness industry.
I
Yeah.
mean, one of the things that I will add to the end when we go through like, what we need to change is it is the healthcare model. I mean, I'm a pediatrician married to an ER doctor, so we are on the front end of everything and we both see all of the problems in the American healthcare system. I mean, I see it from children growing up, my husband sees it for all the older adults coming in, and we both talk about that, right? We both live also a very well life and we're very grateful for that, outdoors a lot. We're in Florida. We're literally outdoors more than we're indoors when we're, in terms of the weekends and stuff. And we love that. And obviously the foods and stuff like that. But it's that predatory wellness. It's the fact that it's not getting better. I mean, the healthcare model is getting so much worse that we are seeing people use the ER as their primary care doctor because primary care doctors aren't making enough money to do their job, right? So
Mm-hmm.
so what do they have to do? And we talk about business because I never want to make it seem like having to take care of your family is a bad thing, right? So I'm talking about the predatory wellness where we're making millions and gazillions of dollars spreading misinformation. But I get that we have to maybe a doctor who has to start a concierge practice, which means that they are taking a fee for every month, right? I get why doctors do that because they get a better balance. They get more time with their families, their patients, they get more time to explain things. And so, although everything is a business, we got to look at the intent of what the business selling is. Like, what is it that we're trying to sell here? Is it that we're trying to sell quality information, that we are trying to do face-to-face contact, right? Like these concierge doctors, which I think is a very valid business model. Or is it that we are just saying, everything is bad, I'm the good, don't listen to anything science says, which is where I get concerned. And the biggest concern I have is that when wellness goes wrong, who are they going to come back to?
Yeah.
They're going to come back to us
Yeah.
because we have the science, right? We have the tech. We have everything involved in sort of in the medical establishment, right? If a child, and I've seen this happen already, right? So if a child goes on a Facebook, or a mom goes on a Facebook group and someone says, yeah, give your child this for some fever, right? Don't worry about giving them X, Y, and Z. Or, I gave 10 milligrams of turmeric. Okay, they're going to end up in my office. They're going to end up in the ER, and then it's going to overwhelm our system. So my concern with the wellness industry is not that we should not have wellness, is that people don't understand that when things go wrong, they're going to go to the very people that they were against in the first place. And that's why I
Exactly.
don't like the black and white, right? I don't
Exactly.
want it to be that I'm against medical establishment and I'm against wellness. I think we all agree that I love wellness. I see an acupuncturist. I used to get chiropractic care. I talked to my husband about seeing a naturopath for a medical issue he had when nobody else could figure it out. It thankfully got better. But I was like, why don't we look at all of our resources here? And I'm okay with that. But I also know the limitations of everything. I know that I should not be getting vaccine advice from a naturopath who's never rotated in a pediatric ICU.
Yeah.
Like, they've never seen the things that I've seen, right? And so
Exactly. Yeah.
that is not fair. And so I wish that it wasn't so much like that. And that's why I'm glad we're having this conversation, because I worry that it's going to flip so much back that we're just going to see people overdoing these things when there's no scientific evidence that people are throwing out for a lot of this wellness stuff, and not saying, hey, we don't know how much elderberry is safe. I don't mind if you take elderberry, but do we know how much is safe exactly for a 10-kilo child? No. And so I give that education because I know the balance, but we all know that balance and nuance doesn't sell,
No,
and
it
it's not
doesn't.
sexy.
No, it doesn't. And what you're really talking about here is opportunity costs,
Yeah.
going back to how we can isolate, how risk is isolated, right? So what is left out of the conversation when we talk about wellness is, what are the opportunity costs? Like, what is it?
Yeah.
If you pursue the path of wellness, what may you be missing out, right? Or what are you giving up? And it's like pursuing proper care, right? The potential harms, the toxicities that have been, pervasive in the wellness, because it's not just like it's harmless. It gets framed sometimes as a, oh, this is harmless. And back to your point, one of the bigger opportunity costs that, I know many people in public health, and are concerned, and clinicians, is exactly that when wellness fails, it won't be these individuals who are at the front of the wellness movement who are
Right.
tending to patients, just like we're seeing with the measles outbreak in Texas,
Right.
right?
Right.
It's hospitals. And what people sometimes fail to see, because again, we're talking about red versus blue states, and not to get political, it really does impact anyone. Because if now there's an outbreak, again, because we no longer die before the age of 5. I mean, not as many of us die before the age of 5. Like, the whole clinical practice has also shifted, right? More to taking care of patients with chronic diseases. And this, children are not just small adults. It takes
Yeah.
specialized care. So now what happens to our systems when it's overwhelmed, especially with children, right? Like, we're not equipped to handle that.
Yeah.
Like, we're not equipped, and then it will impact neighboring states. Like, if we now have to make like space for, people that need hospital care, all of a sudden, yeah, I may be in California, but I may be impacted by an outbreak in New Mexico,
Yeah.
right? Or Arizona, because now, like, there might be an outbreak of, of measles, and they're bringing those patients over, right? If that gets out of hand. And so I think people really need to understand that wellness cannot be viewed in isolation. It's just not harmless. There are things that you're missing out, and understand what the implications of those are.
Yeah. Jess, do you have anything to add about the wellness movement that you feel like we're missing on this, especially with nutrition education?
I mean, I just think, again, it's very important to point out the difference between we need a better term for the wellness that we're talking about because we,
Yeah.
I think, all are on board with wellness. The title of my PhD is actually physical activity, nutrition, and wellness. That was the program that I was in. And so we're just to kind of drive home,
Yeah.
like be living a well life and wellness, how it's always been, like how we've always defined it, is something that we're all, I mean, and medical doctors talk all the time about, you guys get a bad rap for like never speaking about nutrition or physical activity, but the medical doctors I've spoken with, they constantly bring that up, particularly the ones in prevention like primary care. But
Yeah.
there's a difference between that and selling you $130 colostrum supplement because it's going to be some sort of cure-all, right? Or spreading some sort of fear-mongering post about something and then selling you a detox that is an unnecessary detox. And so I just think we need to really make sure that we're focusing in on the predatory wellness when we're talking about wellness, and not, and I don't want people to think we don't want people to live healthy lifestyles, that because we absolutely do, obviously.
Yeah, and that is one of the hardest things being on the front line of health education, obviously being forward facing as a physician. My husband's a physician as well. When my husband doesn't get as much cuz he's an ER doctor, he's literally stabilizing
Yeah.
almost people who are really sick. But for me, I thankfully have a lot of families who come to me knowing that I am a very preventative focused pediatrician. And for anyone listening who feels like their pediatrician is not, I'm going to be quite honest that I'm pretty sure they started out like that, but the system has made them burnt out. And I'm not, I know we talk a lot about that, but I just see it happen so often that my fellow colleagues who had that bright-eyed, bushy-tailed love for their profession losing their light more so after the pandemic. And I don't know what the answer is to that besides maybe getting the white shirts and business coats out of the decision making for healthcare systems, maybe that. But it is a hard reality. And that makes me so sad because I think we have so much to give. I think my colleagues that I see and knowing how I am as a pediatrician and how much more I could do, and knowing that there's hundreds and thousands of doctors out there, pediatricians, family medicine doctors who would love to do the same, but can't because they have to see patients very quickly because otherwise they can't make the overhead because of reimbursements getting lower, is the huge reality that we're facing. And I'm sad. Like it is very sad because people don't realize that doctors are getting pay cuts around the country. I have not seen a salary increase in 7 years. My husband is getting a pay cut as an ER doctor. And it's a sad reality that I we talk about, but we don't talk a lot online because when we start talking about that, well, why do doctors need to make so much money? Well, we don't even make so much money. You know who makes
Yeah.
more money? Mark Hyman. You know who makes more
Yeah.
money? Casey Means, Kaylee Means, Robert Kennedy
Yeah.
Jr. I could do all of that, but we don't because we
We
do
do.
like being physicians, but it's not fair to have to not get a pay raise when the economy's shit, right? And like any job, right? Like any job, I would want anyone to feel valued in. Physicians are not feeling valued, and that is very scary to the
It is very
healthcare
scary.
landscape, and that is just going to increase wellness. The predatory wellness industry. And like
Oh,
I love that term that you put in, just because it is predatory wellness. It's not just wellness. I think everyone, like you said, wants the wellness there.
Yeah.
Yeah. And Jess, how can consumers of information, whether it's online, whether it's wherever they're getting their information from, how can they make sense of these conflicting messages from movements like the Make America Healthy Again, science? Like, how can they approach this and know what's right, know what's wrong? What would you say to everyone listening?
Well, so let me tell you, I and I think you saw it. I shifted my content a bit in the last, I would say, 7 8 months, and the reason is because I saw a huge gap in people not connecting policy to health and to our
Yes.
nutrition environment and to our health. And so what happened was it led to this movement that was enabling all of this misinformation and all of these like intentional misrepresentations of what was happening. So, as somebody who's been studying chronic disease prevention for the last 15 years, it was just very evident to me that people didn't. I heard all the time, like, "Well, this shouldn't be political," or "Our food environment shouldn't be political," and that was pretty astounding to me to hear as somebody who's just studied policy and
Yeah.
the way that our policy has impacted our food environment. And so I started kind of trying to help people to just bridge that gap and understand how our policies do impact our food environment and do impact public health outcomes, because I think it's really, really important for us to understand that. And I think it helps us to kind of see through a lot of the BS that's out there, when we realize, like, okay, so let's take an example. Let's take the West Virginia. They just passed the first bill that banned random additives. Did you guys see that?
No, I have
So
not yet.
I have
See?
not seen
This
it.
is
Yeah.
why
yeah.
we need each other. Yeah.
So I think they banned 7 food colorings, all artificial food colorings, and 2 preservatives. Right. So that's what West Virginia did. One of their state senators, said it was perhaps the most important bill they would ever vote on, in order to improve the health of their state. Now, people have asked me, like, what do you think about this? Are you pro like these bills that are banning food additives? And I wanted to, it's very hard for me to answer that directly, like without explaining why that's not the right question and why I can't answer it, like whether and why it doesn't matter whether or not I'm pro or against it. Because
Yeah.
if you think about West Virginia, they have the highest obesity rate in the nation. Nearly 40% of the people who live there are classified as obese. They have the highest diabetes mortality rate in the country. They're in the top 7 for heart disease. They're the worst in the nation for overall health care. So you just like think about the state as a whole, right?
Yeah.
They lead in drug overdose deaths. So, and there's just so many different things. They rank eighth in the nation, I think, for food insecurity, which is over 12% higher than the average, the national average, and they're 4th highest in the country for poverty. Which is about 35% higher than the national average. So if you think about all those issues, and there's more, right? That's just what's in
Yeah.
like my brain, but there's more. And so if you think about all those issues in West Virginia, a bill to ban artificial food dye out of food is just not what their focus should be on, right? So their focus should really be on things like expanding healthcare, expanding access to fresh fruits and vegetables, helping people to get access to these things, and actual policies that are going to improve health outcomes. And this is just not, this is a distraction. And that's what a lot of these MAHA bills that are coming out, which are these like bans on food additives, they're to distract from policies that would actually improve our food environment and our public health. So what are some of those policies that can improve our food environment? So let's just focus on our food environment. We
Yeah.
can look at our agricultural subsidies. Less than 1% of our agricultural subsidies, which are payments to farmers to decrease the cost of crops, right? Less than 1% go to fruits and vegetables, go to produce. But our government tells us to make half our plate fruits and vegetables. So what we're advising people to do is in direct opposition to what we're actually enabling through
Mm.
policy action. And from agricultural subsidies, we subsidize a lot of corn, wheat, and soy. That's basically where it goes. And ironically enough, that doesn't even really go to human feed. It goes to animal agriculture and it goes to fuel, a lot of it. Some of it goes to humans, and most of that goes into ultra processed foods because that's really the basis of ultra processed foods. And so we're artificially making these ultra processed foods, nutrient devoid ultra processed foods, lower in cost and making fresh fruits and vegetables higher in cost. And those are policy decisions, right? We can change that through policy. You brought up, Mona, I think marketing, right? And
Yeah.
how marketing disproportionately affects low income people and children, right? And so putting regulations on marketing is a policy decision, right? We need to do that through policy. Investing in modern agriculture, those are policy decisions, and like food science advancements are policy decisions. Those are all could like improve our food environment. And it's how our policy has impacted our food. Right now, our food environment is about 70% ultra processed food. Why is that? It's because for decades now, ever since the 80s, going back to the Reagan administration, we have basically enabled corporations to prioritize profits over public health. And so,
Mhm.
what does our food environment look like? Our food environment looks like a food environment that is really beneficial for corporations to make as much money as possible and doesn't really care about people's health and the food. We've decimated local food systems by putting our efforts into kind of big agribusiness, which started in the Reagan administration, and kind of enabling these big agribusiness. And we took away local food systems, and so now we have a lot of food deserts in our country. And we have areas in this country, which you talked about, where they don't have access to fresh fruits and vegetables. They go to maybe a gas station to get some
Yeah.
foods, and they're really far from a grocery store. And so all of those things have impacted our food environment, and we're not kind of like putting those things together, how the policy is impacting our food and then our overall health. And there's a bunch of different aspects of health too, not just food, but that's specifically to the food environment. And so I think it's really important for people to realize that a lot of these kind of bills that are coming out are distractions because of a party that doesn't want to prioritize public health initiatives that actually could improve our health.
I love that you touched upon those. I mean, thank you so much. I know that's part of the list you probably had, and I think that is exactly right on to what I see even more so. I mean, the agricultural subsidiarities that you mentioned, and then modern agriculture as well. But it is a huge issue. And Nini, I know you have data, or you would have some data or some knowledge into understanding the influence of systemic issues such as socioeconomic status on health disparities, right? Obviously, this is not something we're just saying or seeing. This is actually in data that we have over many years.
All right. Yeah. So I think individuals really forget, history is easily forgotten, right? People really tend to not account for the fact that a lot of the regulatory framework that we do have, from like, banning lead paint, right? Like the warnings for tobacco, the Pure Food and Drug Act, right, of 1906. That regulatory framework was put in place because there were issues. People were dying.
Yeah.
The companies couldn't self-regulate, and even like in aviation, we see it. I mean, you take a look at it, like the aviation industry has a flawless record when it comes to transportation statistics. Like, I always remind people that you would have to fly for like over 300,000 years consecutively to be involved in a fatal airplane accident. That's how safe it is, right? And the reason that happens, because we do some of the work that I do is in this industry, is because every time there's an incident, you do what the MAHA movement is not doing, right? We take a look at a systems wide,
Yeah.
right, failure. We don't look at one isolated risk. We don't blame, if we blame the pilot every time, the planes would continue to fall out of the sky, right?
Right.
Because we have to account for pilot error. We have to account for the fact that this person, when faced with, a malfunctioning system, is going to react a certain way. So we build redundancy. And so we take a systems wide approach to correct for every single one of those systems. And then we turn that into a new framework that now every, new, like when airlines train their pilots, they receive those briefings and they correct for it. So it's like self-correcting, right? And with each failure mode, there's new learning that gets incorporated. And that's where it becomes better and better and better, and why our statistics are just impeccable to begin with. And you've seen a huge decline since like the 1950s till now, right? And it's like you're safer up in the sky, right?
Yeah.
Than at any place. And it's precisely because of that. We do the complete opposite. It's systems wide implementation of solutions, which is what I think, everything that they're doing now could borrow from, like, the aviation industry if they try not to gut the FAA.
I know.
Right.
Yeah. That's the other thing is like, I feel like everything that anytime we're like, okay, progress, like a
I know.
policy, you're like, why? Like, but how is this what we want to do? Right. I mean,
Yeah.
you already talked about a little bit of policy, Jess, about that. I completely agree with that. And so I wanted to kind of turn back again to what Jess had mentioned at the beginning about like what in a dream world, what we would envision. I know, Jess, you already mentioned obviously expanding healthcare access, agricultural subsidiaries, marketing, modern agriculture. What else would you add? And then I'm going to throw it to Nini. If she, in an ideal world, what would be better for truly making America healthier again?
Sure. So let's think about what can help to make people healthy. And you have to think about it on an individual level and then a
Yes.
systemic level, right? So if I'm working with you one-on-one as a dietitian, right, and you want to come see me and we're going to chat and help to make you healthier, we're going to talk about diet and nutrition. We're going to talk about getting more whole foods, right? Getting more fiber, because 90% of Americans don't meet fiber or vegetable guidelines, right? So you're probably in that 90%. So we're going to try to help you get more vegetable and fiber, try to maybe reduce your added sugars, your ultra processed foods, your alcohol, all of that. We'll talk about your physical activity. 80% of Americans don't meet physical activity guidelines. We'll try to get you moving, right? We'll talk about your stress and your mental health and your sleep. Are you getting, 7 to 8 or 8 to 9? I don't even know what the recommendation is, but
Yeah.
more than most people are getting. Are you getting that much sleep, right? But then you have to think on a systemic level.
Yeah.
Okay, so, and I think people miss that. So from a public
Yes.
health perspective, we think on a systemic level, like Nini just talked about, right? We don't just tell you, okay, go eat more fruits and vegetables. We think about, why are 90% of Americans not meeting vegetables and fiber guidelines? Why? right? And so then, okay, what are those things? Agricultural subsidies, like we talked about, addressing food deserts, because the vast majority of people who aren't meeting those guidelines are also people who are living in food deserts and in poverty. So talking about economic instability, because that is a huge factor in getting access to fruits and vegetables. We talk about marketing and advertisement, particularly to children and low income people, and putting regulations on these corporations. By the way, we talk about things like Citizens United, which has allowed unlimited money in politics, which has allowed politicians to basically be bought, not, I mean, for lack of a better term, right, by a lot of
Yeah.
these corporations so that they vote in favor of these corporations and against public health measures. So those are systemically. We talk about food nutrition policy, right? So school nutrition policy, and trying to improve school nutrition. And we don't just say, we need to improve school lunches by, offering more fruits and vegetables. Well, like, how are we going to do that? Because the national
Right.
reimbursement rate is $4.01 for the school nutrition program. So if we want to improve the food that's in the school nutrition program, you can't just put a bunch of regulations. You have to actually invest in your school nutrition program, right? So that's kind of like a systemic. Then you think about like physical activity, right? So getting people to move more. Well, why don't we move as much as maybe they do in Europe? We have an entire country that's built for cars, for the
Yes.
automobile industry. Our cities and towns aren't walkable and bikeable, many of them. So you have to invest in infrastructure and urban design. That's called the built environment in public health. And investing in those types of things, transportation policies, getting more public transportation in our cities and our towns, and helping with that. Investing in like school systems, like we have defunded recess programs at school. So thinking about like getting our children more physically active and investing in those like recess programs so that they're out and able to like run around, Then you
I
talk
mean,
about
Japan does it, right? We
yeah,
talked about Japan, like so
Japan
many of
does
these.
it.
You know what's crazy is that so much of this exists. Like we see
Yeah.
models in other countries, and yet we act like it's not doable because we don't want to do it because
Yeah.
there's not as we feel like there's not as much money in it from the
Yeah.
government's or that there's not as much incentive to do it when there is.
Well,
Yeah.
how
And
much
it's
of what I'm talking about is done in Europe? Is healthcare
exa-
access, all of these things, and yet
yeah.
we want to talk about like the ingredients that are used in Europe versus here, as if that's the big moving factor
I
in
know,
in,
right?
in the health disparities that we're seeing. And I could go on and on. There's so many policies. There's
Yeah.
there's even policies that address stress and mental health,
Right.
and sleep. And economic instability, by the way, is a big thing for all of these little buckets that I'm
Correct.
talking about. But each one of those buckets that you would think about, if you were working with a health coach or something one on one, all these buckets that they would be addressing at an individual level, there are systemic policy based decisions that go into the accessibility of those things for people. So for sleep, for example, we still have a 40-hour work week, which we could talk about if that, and we have people who are working 50, 60, 70 hours, not just 40 hours. We have people working 3, 4 jobs, right? And in America, because they're trying to kind of just make ends meet. And so that is not helpful to being able to get 8 to 9 hours of sleep, or helpful to somebody's stress and mental
Yeah.
health. So all of those things are kind of interrelated and interconnected. And these are all evidence-based things I'm talking about. There's data on all of these things. It's not just me with my like, I don't know, pie in the sky like values that I think are helpful. Like all of this comes from data, and show like there's data to show that all of these policies can help improve public health. But we historically in this country have not invested in public health because there's not a lot of money in these things. There's not a lot of money to be made in these prevention things from a short-term perspective. And so instead, we kind of incentivize corporations, and we have, we invest in things that are going to be profitable for corporations, and we don't invest in public health initiatives. And I think that's our major problem.
Yeah, and I love that you went from solo, what we're talking about, and the why, right? That's literally what every visit ends up being. Like, what is the barrier here? It's not always a personal decision that they can't get access to outdoor exercise, right? For my communities, a lot of it is not lack of access to parks, right?
Yeah.
I mean, where are they safely going to go to exercise with their child? Where are they safely going to go where there's not going to be a risk of gun violence? And I'm speaking truly honestly in many cities that I see down here in South Florida, that there is a safety issue. And so that is all systemic, right? That is all the lack of, having the safe home environments, and then knowing that so many people may rely on school systems and the meal plans at schools for a lot of their meals. I don't think many people realize that is a huge source of where they may even get their meal at all. all. And so if that
Mhm.
is being cut, or if that is being filled with food that is ultra processed, they're not getting exposed to that. And for me, a lot of the biggest thing for nutrition also that I find is a lot of more culturally competent nutrition education, right? We are not the same
Yeah.
culture in this country. We are a melting pot of different people. And I think that's actually sometimes a bad thing, because people forget that people may do things a little bit differently. And like, I'll have families come in, and I have a very big island population. So Haitian, Dominican, and a lot of the food education has been passed down. It's like, well, what alternatives can you make, right? And having that more culturally competent education, having that sort of discussion with these families, for me from a young age, is so important, so that we can say, well, it doesn't have to be just that. What are you making? What are some swap outs we can do to make this a more fiber rich, less added sugar, sort of meal for the family? Because I see that all the time as well. And I want there to be more education. And then when you talk about policies where we think about taking away education departments, which has not happened. I don't want to say that it's going to happen, but it makes me just a little, because a lot of those education programs will fund the public school education in a lot of red states.
Correct.
And, because when you don't have state income taxes, when you don't have the ability to fund these schools, and you're not getting any money from the government, I worry again about, we're going to see far more separation in the haves and the have nots in this country, thanks to these policies that really don't have everyone's best interest at heart to promote the foundation of education and health.
Not
Which,
only that, like we know it. Health outcomes are directly linked to educational attainment.
yeah,
So going back to what Jez was saying about policy, when we take a look at our education programs, right, defunding education, right, is not the way to go. It's really interesting because I recently saw like this great thread, and somebody was like, well, if you're feeling bad today, just remember that you did not fall for billions of dollars in propaganda, right?
yeah,
Which is true. Why do some individuals not fall for that, right? And then we get into the role of social media in creating these binary ways of thinking, and why some people fall for some of these ways of thinking and some people don't, right? And then we really see the influence of education programs and educational attainment, right? And then there's almost a straight correlation. That sure, there are outliers, but for the most part, you could really correlate educational outcomes with making the right decision, and of course, and how that plays into your overall health. Like I know, for instance, that I'm not going to be able to cure, right, a virus with an antibiotic, right? Like like
yeah.
I know that, right? But most people don't seem to understand that. Um, so yeah, I just wanted to add that to Jess's point, because I'm really huge on like educational attainment and what we can do to improve communities so that they get more access to quality education.
The concerning part, which I want to be so I've lived in Arizona, California, New York, and now I'm in Florida. And you can tell the difference in a public school education. You can tell. Like when you go to the common store, it doesn't matter if you are wealthy or not. You can just tell based on this basic information that I'm talking to. When I talk to patients, and I'm shocked to hear them think certain things, and I'm like, well, look at the public school education we have here. Like, it is not as great as the basic public school education in a lot of states that have good public school systems. And it's a sad reality. And I worry, because I know these are the foundational things that all communities need, especially when we look at other countries and other health outcomes. They have great healthcare systems. They have good education. They have early education that's free and accessible, and you go back to the thing about stress, Jess, like so many parents are stressed because not only is housing costs really high right now, and it's not going down, it's worse than
Mm-hmm.
we've ever seen it. You also have the stress of making ends meet when salaries are not even going higher, and they can't even make rent, and then or even just basic needs, right? So they can't afford the healthier foods because they also can't afford their house. So what do we want to do here? Like, are we going to bring down the rent costs? Are we going to do any subsidies there? Because the families are going to have to make a decision, and the decision will probably mean taking a cheaper food item that may not be as balanced and nutritious, because if they can't pay rent, they make the cut somewhere else. And it's so sad to see this. And as a pediatrician, when I talk to these families and I'm trying to make these decisions with them, I can't make them have better resources. That is one thing that's a barrier for me, right? Because I can give them all the education I want, but we often forget that the resources are lacking for so many of these families. And it's when I think, what is it? I think 40% of Americans, or I could be wrong with this number. I don't know if either of you know, how many Americans live below the poverty line in America now? I think it's like 30% or 40. I have to look at the number, but
Yeah,
like,
I have to take a look at
it
that
is,
number.
yeah, it is really sad to see that we are having so much people that are not able to just basically make ends meet, that their health is going to go out the window because they're stressed and they can't eat healthier. They can't get outside when we all know these things make us healthier than removing seed oils and removing all the things, because that is not the individualized thing that's going to make everyone healthier. Because I
Yeah, and I
also
just
don't want these people in the, yeah.
And I just think to bring it back to this like Make America Healthy Again movement, if this movement like and the I mean, what would you say percentage wise is the rhetoric of like add like seed oils and food dyes? It's like almost all of it, right? In terms of
Yeah.
like what they're talking about in terms of like improving health. If that rhetoric was within a movement that was focused on all of the things we're talking about to improve public health, like I don't have as much issue with it, right? So okay, I mean the seed oils I actually do because that literally flies in the face of evidence, but the like other additives that I mean really like food dyes are really there as a marketing tool, right? And they're really in these like these foods for children, and oftentimes those are ultra processed foods, and there is some evidence that if we kind of muted those dyes that children might not be wanting to eat them as much. So we may actually help them to eat less sugar by just them not wanting as many things, right? So there's like a nuanced conversation to be had about those food dyes. It's not what they're saying, which is that they're like toxic and going to hurt us. But I think that if it was within this overall context of all of these other things that we're talking about that are actually going to make a huge impact on public health, I think that's fine, but it's not. And so it's really the focus of Make America Healthy instead of and a distraction from all of these other policy positions that the party that MAHA has aligned with has routinely voted against. I mean, that's just the reality. And so the distraction is okay, don't look over here. And as
Yeah.
people in public health, they haven't worked with any public health experts, any nutrition experts, anyone who actually has been studying this stuff. They've primarily worked with kind of like wellness influencers overall. And so that is kind of our biggest issue is that it's not going those things aren't going to these bills that are coming out to like ban random ingredients, they're not going to improve public health. And so we're going to stay focused on that so that there's no pressure put on our politicians to support all of this other legislation that could actually improve our health. And so I think that's really the biggest message I have of this movement is that we need to think we all want a healthier country. We all want
Yeah.
our children to be healthy. And so like what are the evidence-based ways to do that versus like the sensational distractions? And I think that's really important to point out.
I completely agree with that. And by the way, 11% is the national average for below the poverty line, but it can range from anywhere to 5% in certain states to about 25% in certain states. So,
Wow,
Miss,
huge
Mrs.
disparity.
Yes, exactly. But I wanted to clarify that because facts and numbers are important.
Yeah,
And
yeah.
so,
They
my
still
my last,
are.
yes, they still are. Now, I want to bring back the first question that I had to kind of wrap up is that, some people might hear this conversation and think we're skeptics. Like, why wouldn't we want higher health standards, better food policies, and more curiosity about what's making people sick? But I hope by the end of this conversation, you have realized that we all want that. How would you say that someone can manage healthy skepticism with ensuring that we're not falling into this fear-based anti-science narrative? Like, because again, I think it's important that we can question things, but where is that sort of balance in saying what is questioning versus what is actually just now misinformation? And Nini, if you have
Yeah.
how can people as consumers listening and on social balance all this information?
So in the beginning of the pandemic, right, people were really interested in the information of COVID-19 because it was directly impacting population outcomes at the individual level, the population level. Hospitals were, flooded with patients. People were, dying. People were getting long
Yeah.
COVID. Parents couldn't send kids to school. That was a big one. I was not a parent back then, and now I'm like, holy cow, that would have been really
Yeah.
hard. So people were really interested in science. And I think that was an opportunity where you saw a lot of the science communicators come out of the woodwork, right, to explain these concepts. And Jess made a fantastic post the other day exactly about that, which I really loved. And she said, this is an opportunity to really also bring people in. And the framework that I like to use revolves around how do we merge this intellectual curiosity, right? Let's call it intellectual curiosity as opposed to healthy skepticism, with intellectual humility, right? And that's where you really get into like, you want to work with other people that are more experienced, professors of rhetoric and persuasion. And the framework that I try to advance is more of a, these are the right questions to ask, because these are valid questions, and really teaching them. I do more of the data stats side of things.
Yes.
So I will teach people like, okay, what is the likelihood that you could repeat that study? Why or why not? Does this population represent the rest of the population? Why or why not? And that way I kind of, I don't want to, you don't want to squash out the question, but you want them to help you. You want to guide people and help them engage in a way that they are still curious, but also acknowledging the limitations of their own understanding. And so I think it will be an opportunity for many of us. And agree with all these points made. Unfortunately, science is behind a paywall. A lot of the science is really complex. Like I struggle reading some papers on like immunology. I'm like, like what does that mean? Like I'm on threads with other communicators. Like, what does this mean? And so, so I think making the information more accessible, but also, really creating an environment where you bring in that intellectual, curiosity, because it's not healthy. It's not healthy to squash that out. That's what I consider to be anti-intellectualism at that point, when you're telling individuals, oh no, don't read that. You're not going to understand it. And I'm like, that's so impractical. What are you going to do? Stop them? Like, they're going to get their information from somewhere, right? And you want them to be a well-vetted source. So you really want to invite people in. Granted, you're always going to get people that are not engaging in good faith, people that are just really there to bully, troll, try to, destroy your credibility. Like, that's always going to be there. But for most individuals, right, those are a loud minority, but most individuals really do want to, ask these questions and get answers and want nuanced answers. And I think our role is to try to provide a space for that. And it's very hard because, as we kind of reemphasized here, we are in a social media platform that really, favors binary, ways of thinking, right? This or that, right? And emotional ways of thinking. But that's like the path that I would want to continue on, is just trying to engage. And of course, my perspective is the data science one. It's like, okay, let's ask questions about this data. But I think we can all do that. And I've seen Jess just grow so much, and I'm so happy because she really does bring such a valuable perspective. I'm always like DMing her. I'm like, oh my God, I'm so excited because I really am, because it's such a valuable perspective, right? We all have a different perspective, and it's so important to really, people are interested in science. I think that's great. And sometimes it takes these movements to get people interested in science and health. And I think we got to take advantage of that.
And I think that's what this conversation did. Jess, did you want to add one more thing about like a final message?
Yeah, I'll just add, I would echo everything that Nini's saying. And I found success in the last, half a year. I think that it's really important to understand that, like, we want people to have a healthy skepticism, right? Like, that's why we got into these fields. Like, I got into science and like wanting to go get my PhD because I had all these questions that I wanted to answer. And so like we should welcome that, and not do these appeals to authority. And I think where my success has come from is that people are interested in these topics right now, like more so than ever. And just like a plain explanation where you're providing actual data, you're providing actual evidence for things, showing like, here's why, here is all the evidence, or some of the evidence at least. And then also, here's what to look for people misleading you. Right. So it helps people be like propaganda proof. Right. So like, if someone's just like telling you like a really seems inflammatory, maybe it's not, maybe it's real, but if it seems inflammatory and they provide absolutely no evidence for that, then that's probably somebody misleading you, right? Because if it's inflammatory, generally for me, like if it seems like too wild to be true, like I will bring even more evidence than if it was just something that would be like welcome and accepted.
Yeah.
And so helping people to like know what to look for on the social media space, I think can be really, really helpful. And then like allow them to ask questions. Like I love when people ask me questions. And I think that's a big red flag too, because there's an account, I'm not going to call them out, but there is an account online that a lot of people are always DMing me about. And I didn't know much about the account. And so they provided some evidence of like lead in food and then compared it to something that I didn't think was an appropriate comparison. And
Yeah.
I sent them a very nice message, like in their comment section, and asked them for clarity. And they did not respond to me. Well, they did not answer my question. They responded really, really upset about it, made a bunch of like posts about me, and then blocked me. And so I don't think that's really the healthy way to go about helping people to understand things, right? So if people ask me questions like and they're genuine questions, I always
Yeah.
welcome them. And so if you ask somebody a question on social media and they respond in a really like aggressive or derogatory way, like that tends to be a red flag too, that person's not genuinely spreading information. So I think just helping people find those things to look for.
And I think that goes on both sides to kind of bridge both of your responses, right? Like in the pandemic, there was a lot of science communication, and a lot of it comes from us, like science communicators too. Like, how are we responding? Not only the people who may be spreading misinformation, but are we using fear-based messaging and
Mhm.
like creating fear versus like, even with the measles outbreak right now, I think there is a balance of like, hey, here's the controllable things that we can do. You're not gonna die tomorrow, like I promise. Like, there's more of this sort of what can we do to reduce risk? What can we do to protect the kid for the age that the child is versus fear, 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 fear. So that comes on a communicator side. And I think that builds trust as well. So that we have, here's what we would do, data to support, like you said, and then have the questions open and then also create some boundaries if there is some trolling and, anger, because there is going to be that. But I
That's
love
why I
this.
said genuine questions.
Yes, exactly. Because sometimes I'm like, okay, now we're falling down deep into this hole of personal attacks, and we didn't
Yeah.
even go there. So, but that is something that I've learned from the pandemic. And I will be honest that when I started educating on the pandemic, I used to be very, well, this is what it is. And the pandemic really changed me and how I communicate, not only online, but also in my office. And I'm grateful for that experience, although it was very traumatizing, to be honest. The pandemic was. But yes, I think that's going to be a huge shift. And I think that's how we're going to keep the trust, regain the trust, but also provide that balanced, nuanced education that people should have. And I love intellectual curiosity as well, like both of you. And I'm
Yeah.
glad that we could pow out today.
Yeah,
Yeah.
this was
Thank you
great.
both.
Thank you for having us.
So where can Jess, where can people go to stay connected with you? I'm sure both of our listeners know who you are, but where can they go to follow you along?
My biggest platforms are Instagram and Substack. And so I am there on both of those platforms. I write a newsletter twice a week, and I'm on Instagram pretty much every day.
Handle? Say your handle
Oh
again.
yeah,
Yeah.
at Dr. Jessica Knurick.
Awesome. And Nini, what about you? Where can people go to stay connected with you?
Same platforms, I'm
Mhm.
on Instagram is my main platform. Substack, less frequent, maybe like once a week or every other week. Because I try to do like data driven, blogs, which takes me a little bit to compile all the data. But I am at Nini and the Brain, but mostly on Instagram.
Awesome. I will
Yeah.
be tagging both of them on this on the show notes. Please follow them along. They give great education, not only during health outbreaks and things like that, but just in general. These are amazing follows that I think you should both have, which is why I'm glad that they could come on the show. And this conversation highlights just how complex health really is. Real health requires looking at both personal choices and systemic barriers, which is why I wanted Jess and Nini on to talk about that and how we can get curious about our health, better standards, but not dismiss science and the advancements that we have. So a huge thank you to both of you. And if you love this conversation, for all of you listening, please give this video a thumbs up. Please make sure you share it with everybody so that we can spread this information and how we all want America to be healthy again. Thanks again for tuning in.